They like to stay on top of all of the regulations, but yet they don't have a formal plan, which really puts them at risk.
The people in this room aren't the doctors who work directly with patients.
It's useful for them to know from a strategic perspective what this means.
But the work and information gathering the team at Doctors Management does for healthcare providers has a direct impact on patient care.
Well, the performance and the patient care, I think, go together. So if you reduce the stress of the staff, you reduce the stress of the physician, and you increase the profitability of the practice, what you're going to have is a happier staff, a happier physician, and people that can focus on treating the patient. And when they can focus on treating the patient, obviously the patient gets better care.
Doctors Management has been consulting with health and medical professionals since 1956, and today assists 20,000 physicians nationwide, helping them navigate the paperwork, the payments, the rules and regulations, and the risk of not keeping up.
And what they quickly realized was healthcare is so complicated. One person can't know everything. So the doctor can learn how to treat a patient, but they're not going to know all the ins and outs of how to run the business.
Doctors Management simplifies the business side of healthcare so that their clients, physicians, healthcare administrators, and compliance professionals can focus on helping patients and control the future of their business.
So what you're looking at here is the main dashboard on our compliance risk analysis systems.
Data collection and advanced analytics are some of their tools. When Frank Cohen joined the Doctors Management team in 2014, he brought with him the risk-based auditing software solution called the Compliance Risk Analyzer, or CRA.
This is an expert-based software system that depends upon the use of predictive analytics in order to help a practice predict the likelihood that there's going to be an audit, or if there is an audit, which providers, which procedure codes, which modifiers are most likely to get audited.
So what's the great success about CRA is we're able to identify the most important claims to review. So we don't have to cut corners on the analysis, but yet we're able to provide a much more cost-effective approach for the client. So again, they can lower cost, not increase cost, in this era of more regulation.
Sean Weiss, Vice President of Compliance at Doctors Management, further explains CRA's success. Could you highlight any success stories relating to compliance or cost savings?
I will tell you that in our department over the last 10 years, we have a 98.6% success rate of getting audit refund demands significantly reduced, and I would say in more than 75 to 80% of the cases outright thrown out.
The predictive analytical technology that is the foundation for the CRA system is the same technology that can help a practice find inefficiencies in workflow or predict which doctors may face a malpractice suit. It will even inform practices which patients are most likely to skip their appointment.
I want to be able to not estimate the ratio of no-shows. I want to predict which patient is not going to show up, because if I know that in advance, I can contact those patients, maybe more than just some auto-robotic calling system to remind you of an appointment, but actually contact that patient to see whether there's any issues, and if there are, to try to resolve those up front, because no-shows are ridiculously expensive. You know, a physician sitting around waiting for a patient is the greatest inefficiency there can be in a medical practice, in my opinion.
Convincing a practice to use an outside consultant to find inefficiencies and areas for risk isn't always easy. Doctors Management is confident the value of this specialized information is catching on.
Predictive analytic modeling is really a process that uses data mining and probability to forecast outcomes for our clients. What's important to understand and why our clients get so excited is that each model is made up of a number of predictors, which really provide variables that are likely to influence future results for their organizations.
They want to treat patients, but they also want to be profitable while they're doing it. It is a business, and they deserve to earn money while they're doing it, and we want to help them with that. If
something is observable, it's measurable. And I think that's one of the messages we try to bring to these organizations, is that you can measure anything. And if it's quantifiable and you're not measuring it, you can't manage it.
Risk-based auditing is just one problem to solve, but Doctors Management is solving a lot of problems through their predictive analytics products and tools. The result? Providing patients with better quality of care. In Knoxville, Tennessee, I'm Stephanie Aldrich.